to our panel discussion, demystifying postpartum depression and anxiety. This morning, we have several people to introduce. Dr. Cara English, holds a doctorate in behavioral health with 20 years of experience in the field of psychology, counseling, and integrated behavioral health care. She has opened Terra's Place with a mission to serve women and families suffering from perinatal mood and anxiety. We have Michelle Lacey. She is the clinical director for Women's Health Innovations of Arizona and is a licensed professional counselor and certified perinatal mental health clinician. Thank you, Michelle. Stacey Woods. Stacey Woods is a licensed in Arizona as a registered nurse, international board certified lactation consultant, as well as a certified nurse midwife. Stephanie, thank you, Stephanie. She's a board certified family nurse practitioner with a practice focus in pediatric primary care. Thank you, Stephanie. Stacey. Cindy Herrick is the strategic partnerships lead for 2020 Mom and the first Arizona maternal mental health ambassador. Her main focus has been to integrate the discussion of maternal mental health care into mainstream national health and mental health care systems. Thank you for being here, Cindy. Dr. Christine Brass-Jones is an OB/GYN and the medical director and co-owner of the Center for True Harmony Wellness and Medicine, providing healthcare for women that integrates conventional Western medicine with naturopathic and holistic techniques. Thank you for being here. Thank you, everyone, and enjoy.
I don't know if I can pull this over, but I'm Stacey, and I'm going to sort of be the one asking some questions and moderating some of this, but I know that the meat of what people are going through is out there, and so we're some providers, and we're in the healthcare side. This is a snapshot of just today. We have 45 minutes to discuss some of the important parts of postpartum mood and anxiety disorders, but we really would like to hear from you also. We want to hear your questions. We want to be able to answer any maybe things you've heard that you're not sure if they're true. And I really just want to thank all the moms for being here, and families and dads. And it's really great to see some men in the audience also. So thank you for being here. Thanks to all the moms who are struggling right now for being here. I know how hard that is, and this might be a little bit triggering for some of you. So I want you to know that we're here for it. It's okay to be crying or having whatever responses you have today. If you need to walk out, we understand. But we're all here for you now and after. A lot of these people have booths out there to get more resources if you feel like it later. Okay, so thanks for all the people who've been through postpartum mood and anxiety disorders in the past and who came here to maybe start to discover how to deal with some of the trauma that you've been through. Even if you see it as just a distant memory of something you went through or something your friend or your family member went through. It's really nice to be able to have an opportunity to revisit some of those feelings and that trauma so that we can begin to massage it and work through it and move forward so it doesn't keep impacting our relationships and our family. Right? Is that better? I bought one of these karaoke things for my son, and he walks around the house going, "Baby shark!" All morning. But they're cool, they're on Amazon. Anyway, and so thanks to everyone else who's here to learn how to help moms and families get through this. We're all still brainstorming. We're in the infancy of the momentum that is growing and building to help deal with the major life event that becoming a family is. And so we're just in the infancy of how to really help people and help our community cope better with this. So, hi. And then we have this adorable cute baby here who's also in the midst of all this. So, did we introduce you? Okay.
I asked Shannon if she would mind speaking her story today, so I'll let you introduce yourself and Natalie.
Hi, I'm Shannon Beaver. This is Natalie Beaver, and she is 2 months old yesterday. I had extremely severe, almost psychosis level postpartum depression and anxiety the first time around. And I'm sorry I'm crying, but it's like emotional. I've been really lucky to have a super awesome support system this time around, and I thank God, and that's probably why I'm crying, not had it this time. So I'm really excited to be here. I don't know why I'm crying, stupid.
All right, so I really want this to be a very casual exchange. So just chime in, raise your hand if you have questions for the panel. And let's just start with something pretty basic, if that's okay. Can we just start with understanding what do we mean when we say perinatal mood disorder, perinatal mood and anxiety disorders? PMADS is how a lot of people talk about it in our field, but we all know it as just like weeping and what's going on. So what's the scope of that? Can someone just kind of give us a brief overview of what we're talking about?
So I always like to share that because I think oftentimes we hear a lot of people say, I had the blues. And really the blues is something that occurs in the first couple of weeks, and it's a result of that huge hormone shift that's happening, and then the sleep deprivation and your body healing from delivery. But after that, we have like a spectrum that can occur from depression to anxiety, post-traumatic stress, OCD, and psychosis. And what happens sometimes is we hear on the news tragedies, and unfortunately they refer to it as depression, and that's not what that is. Oftentimes that's what postpartum psychosis. But depression in moms in the postpartum, if it's going beyond that 2 weeks, we're looking at something beyond the blues. I can go into more of the details of those things, but that would take a while. Yeah?
Yes. How long can postpartum depression last? When can it start? Can it start in pregnancy?
I see moms years after their babies have turned 1, which is normally what a lot of providers will say. It's the first year, right, after birth. Moms are often continuing to experience the symptoms of depression, anxiety, OCD, like Michelle mentioned, and are only just now realizing that it may have had something to do with becoming a mother for the first time. It may also have been that there were some mental health issues coming into the pregnancy that were never treated properly, and they did not receive the care that they needed during their pregnancy, during the postpartum period, and so they're finally getting the care that they really deserved all along. And so I don't tend to say that there's a length of time or an end date on postpartum depression and anxiety disorders. But what I like to say is that, there are some special characteristics of what goes on during pregnancy and postpartum, both physiologically, hormonally, and also the identity and role transition that we make when we're becoming a mother for the first time, for the second time, for the 10th time. And so those are special things that fortunately we have providers who have special training in that area, so we know how to help parents navigate that process and that transition. But really it's all about just getting the care that you need and not thinking, oh, well, I've had moms come in and say, I'm 6 months postpartum, I'm 2 years postpartum. Can I still get care? You can always get care. So we just want to make sure everybody knows that.
The other thing that happens is oftentimes when we have our baby, all of our stuff tends to come up, even if we've dealt with it in the past. And I hear moms say to me all the time, like, wait, I dealt with this already. Like, this shouldn't be happening. And then for whatever reason, because there's so much change that's happening during this time, our previous trauma or other issues and struggles, and I always say our mother issues will always come up when we have a baby, whether it's our first or our 10th. And even if we have the best relationship with our mothers, it comes up. And so I think with what the work that we all do is our goal is to walk alongside families as that stuff comes up, because that's not what we expect, right? We expect this to be so exciting. We prepare for like all this happiness, and then we're kind of blindsided when all this stuff comes up. And there are lots of, as Cara said, lots of people that work in this area now to provide that specialized care, to walk alongside you. You are not alone in this. And I think, many of us have gone through it as well, so we get it on that side of it. We're just not coming from the perspective of, I read this in a book. We've lived it as well.
So let me talk a little bit. I'm an OBGYN, so I'll get you like before you even have the baby. And so a lot of times on the information, it just says depression. And I have a tendency to just kind of dig a little deeper and say, well, what does that mean? And get a little bit more information. And it's funny because a lot of times I'll have a student who comes into my office and they maybe go pre-screen the patient first, and I'll be like, well, what did they say about that? Well, I didn't ask about that. I'm like, well, what do you mean you didn't ask about that? This is very important. We need to know, what does this mean? Does this mean like your best friend died in a high school tragedy and you had some depression for this amount of time? Does it mean you've been struggling with this for your whole life? Does it mean you struggled with this in a previous pregnancy? Like, what does this mean? And we have to kind of try to pre-screen you beforehand. So you might think, the doctor is nosy. She's nosy. But I'm trying to find out, and yet it will blindside some people too. I get, we see like other things, maybe you thought you put that behind you, that was an old issue, whatever. But I am constantly screening, and we are in my office screening. And I tell people too, just because we think you are depressed or may have depression or at high risk, doesn't mean I need to throw you on an antidepressant. There are so many other ways to deal with that. But here's the thing, you just have to make that first step and just reach out and let us know. Did I just ramble? No? Okay. Yes.
And sometimes your triggers aren't necessarily just going to be, I had a baby. You could be like triggered by watching a TV show. I cannot watch anything to do with children getting hurt, like, still. I know I just had another baby, but like after my first baby, granted I got pregnant again, but she's almost 2 and I still can't watch anything that's violent, or even just like, I used to be a like thriller junkie, like I'm talking cult, films and all that stuff that grosses me out and makes me sick to my stomach now. And then I'll have like empathy for the character, and I'm like, why the hell am I crying for this like stupid person that I know is an actor and they're totally fine, it's just fake, but yet I'm bawling my eyes out because like I can imagine me being the mom in that situation. And so like sometimes you'll get triggered by the dumbest things, and it's just like, I thought I dealt with this, like you said.
I'm just going to add something to that. I'm not a clinician. I'm a mom with lived experience, and I think it's great to know about the spectrum of maternal mental health disorders, but I really want to address something that I think a lot of us don't want to talk about, and that's stigma. It is a huge part of this equation. We can tell moms to go out and reach for help, but I think as moms, most of us, in the back of our head, we have this expectation of, I'm going to have a wonderful pregnancy, and I'm going to be a great mom, and I got this, I read the books, I've gone to all the classes, and then we get hit with this panic. And I know this because I had perinatal anxiety and depression, and I remember getting pregnant and being sick and all this stuff, and nothing was the way I wanted it to, and this isn't what I expected. And then, intrusive thoughts come. I think I've heard that a few times. There's anxiety, and then there's intrusive thoughts where we get really scary thoughts about, and I don't want to trigger anybody here, but we get, really scary thoughts about what if, and then we're like, why are we thinking this? No one else is thinking this. Well, actually, no, they are. It's just that a lot of times moms don't want to talk about it because they're going to take away my baby. I'm going to be labeled a horrible mother, and I don't want to talk about this. No one else is dealing with it. But really, it's kind of this best kept secret that shouldn't be a secret. And so, part of our mission is to destigmatize moms that need to be mothered and need help. Just because you're a mom doesn't mean that you don't need help. Yeah, absolutely. And I'm a mom to a 6-year-old, and I still don't got it. And that's okay, and it's totally okay. So I just wanted to throw that stigma piece out there where, it's not your fault that you feel this way, because we see it in social media, we see it in other people's filtered pictures, moms that don't have laundry, moms that don't have dirty dishes. No, we just don't see the camera pan to the other side of the room, right? And so we set up these false expectations, and we see moms feel like they fail when really they're not. They're just being realistic. But, so I really want to also emphasize that we set our moms up for failure sometimes, and it's a cultural thing that we really are working hard to remedy, because that's not right, and you guys deserve better.
Can I just touch on the pediatric part of it? So I'm a family nurse practitioner with a practice focus in pediatric primary care. So, in pediatrics, we're kind of uniquely positioned because we see you all from the time you have this little peanut and you bring him in to see us. We'll see you 4 or 5 times before you see your OB/GYN at the 6-week postpartum visit, unless we get you there soon or we have concerns or something like that. And one of the things I really kind of get down to the ground level and talk to my mamas about is just kind of being honest with me. You don't know me. You don't know to trust me. I'm here to take care of your child, but I'm certainly there to take care of you and walk on this journey with you. So I will ask you, and your child's pediatric professional will ask you, how are you feeling? How are you sleeping? We expect you to be sleep deprived, no sleep. We expect you to have bags under your eyes and hair all toss it up and maybe not change your clothes or shower in a couple of days. We expect all of that. But, we may ask more in-depth questions. We're going to look at how you bond with baby and really be honest with your child's pediatric professionals, because we'll see you a lot. We're there not to take your baby away, and there's certainly a lot of stigma, and I can relate to that. I remember lying on my 1-month postpartum depression screening tool. I told him I was fine. I totally wasn't fine, but I expected myself to be fine, and anything less than experiencing utter joy after having my first large 10-pound baby was completely unacceptable, right? So we share those things, and your pediatric professionals will kind of share those stories with you and try to get to know you. It's just really honest that you're honest, good that you're honest with them, so that we can kind of help you and let you know what's kind of normal, and let you know when we may need to watch something a little closer. So just being honest with your child's pediatric professional is really important.
I'm just gonna piggyback off that and add that sometimes, I personally hate that question. I don't know about y'all moms, but I hate the question of, are you okay? How are you doing? How's your mental health? I don't know. I'm fine. I've got this. I might be crying in the bathroom, curled up, at the 2 o'clock hour for the 600th feeding of the night, but I don't know. I'm just managing. So sometimes you have to rely on your partner. And sometimes, honestly, I didn't even know that I was psychosis level almost until my husband was like, what the hell's wrong with you? We're gonna get you help. So don't it's great to come and be honest with your provider, but sometimes you have to rely on your partner. They're the ones that know you the best. They're in with you day in and day out. Yes, they're sleeping next to you comfortably and don't have to get up with your, boobs hanging out and all this, right? So they're just rolled over, snoring the whole time. But they know you the best, and they're gonna be the ones that are hey, there's something wrong. You need to talk to somebody, or, reach out to a friend, call your buddy, whoever. It doesn't have to be a provider, it can be a friend. And then, sometimes nosy friends like me will say, hey, I've got something that will help you, talk to this person, or, try this treatment or something like that. There's a lot of natural things that you can do if you're not one that wants to go the medical route, and be on prescriptions and whatnot. I'm super, I've been on them, and for me, they didn't work, so I've tried some more natural stuff, and it's really helped me. But reach out, don't be afraid to ask your partner for help.
I'm glad you brought that up, because one of the things that really helps me, obviously, we know there's an issue when we ask moms to report on themselves, because no mom wants to seem like she's not doing well, and I've had moms cry just in the waiting room when we give you the screening tool, because they say things like, I feel like I failed this test. Okay, it's not a math quiz. We did not give you a math quiz that you just failed. It is 100% us trying to just figure things out a little bit. But at the end of the day, we get it. And I was that same mom. I did the same thing. I lied on my own postpartum screen, although my OB just said, so how are you doing? And I said, fine, and she left. So it's a little bit better now. That was 13 years ago. So, one, be honest, yes, but B, tell your partner to be honest with you and with the providers that you're going to see. And if you feel like you're not going to maybe be brave enough to bring up that you don't feel okay, or that your partner feels like they're worried about you, bring your partner with you, bring your mom with you, bring your girlfriend with you, bring somebody with you who can be there and hold your hand and say, yeah, I know she's saying that she's fine, but she's actually really not, and she wanted me to come and make sure that she felt strong enough to say something about it so that she could get some help today. What are the options? So, mom brain, fog, and how long do you have with your provider is another issue. Sometimes you have a lot of questions or a lot of things to discuss, and that kind of gets pushed to the side when there are other things. If, baby's health is a worry, or your health is a worry in other ways. And so you're right, making time for that in the consultation is really hard to do if you're mom brain fog.
And a note on support, people. We know that social support is a protective factor. And it sometimes won't mean that it might not be my mom that's my support, or it might not be my sister that's my support. But there are people who have gone through this. So find those people. If you find one person, you say something to one person, they're like, I remember being pregnant, being depressed in my pregnancy, and saying something to my friends, and they're all being like, Of course, then I was like, well, I'm not going to say anything to anybody else, which was my mistake. At the time, there wasn't a whole lot going on in this area, so my kids are older. But go to the next person, because I promise you, this is the #1 complication of pregnancy. You are not alone in this. And if your mom or your sister or your friend doesn't get it, keep talking. There are other people that do get it. You are not alone. And I think we feel very much alone when we go through this, that we must be the only person going through this. And we judge the thoughts that are going through our minds, and so we're less likely to reach out. If you leave with anything today, you are not alone, and there is support out there. And just an event like this in itself is so unbelievable to show that there is support out there.
Just one little tidbit to add to that. I know we always say that it's the most common complication in pregnancy and maternal complication. Just to put that in perspective, how many of you know what the pink ribbon stands for here? Breast cancer? Do you show of hands? I think most of us know what it stands for. Did you know that there are more new cases of maternal mental health disorders being diagnosed each year than breast cancer? And if there is a provider that is not listening to you, I implore you to tell them that, because it is more prevalent than diagnosis of new breast cancer cases each year. And so, as Michelle's been saying, you're not alone. It is very, very prevalent, and I think that really puts it in perspective for a lot of people.
And I think also, I would try to encourage you to reach out if you can to somebody, even if it is to your provider. Maybe it's just at a regular visit. Maybe it's even before you get pregnant. And you kind of discuss these things beforehand. Because, it scares me when I get a phone call from somebody and they're already on that other side, and I need to kind of, try to pull them back. And a lot of times I am talking to okay, who's there with you? Who is there with you right now that I can talk to so that we can get you help right now? So it may be you may be 10 weeks, you may be 1 week, you may be 5 days, you may be 24 hours. Let's start that discussion. Let's start that discussion as soon as we can.
Okay, so that's a little bit about what some of these mood and anxiety disorders are, and what maybe next we can talk about is what are some of these treatments that are available. I don't know about any of you, but as a nurse midwife, I thought, oh my gosh, I take meds. I had in my mind for decades before I ever experienced postpartum depression and anxiety that I was not going to take a drug. I don't know. I really had no reason to think that. I also never thought I'd get postpartum depression because I thought I knew how to do it all. I also wrote the policy for Dignity Health on how to screen for postpartum depression. So I really thought I really had it in the bag. But it turns out I didn't recognize it in myself, which to your point is so important. How do we engage our partners and our families so that we have like a safe word or we can talk about it ahead of time and do some preventative planning, like some of the organizations here have our 4th trimester plan, like to come up with a plan ahead of time and really engage our families so that they can say, Stacy, or whoever, it looks like you kind of tipped over into the dark zone and you're crying all day. I was like, I'm fine. I was like, my husband looks at me, he's like, is it normal that you cry, like 10 hours a day? I was like, I think that's pretty normal. Should I be doing something? I'm like, no, I've got this. So, oh man, so let's just say, there's medication, and tell us about some of the treatments that are available for women. There's a lot of stigma about going on medications that you really like, ooh, you failed now. So,
I'm a big advocate for prevention, and so I like to start the conversation really early in the pregnancy or even pre-pregnancy planning with how to care for yourself, how to nurture yourself, because we're not taught how to do that. It's the last thing on our list most of the time, especially when we're taking care of maybe a job, maybe a house, maybe a husband, maybe a partner, maybe a older family member or other children. And so self-care is something that is a skill. It is something you have to practice. It is a new behavior, and new behaviors are hard to learn, and they're even harder to stick with. Who's tried going to the gym as a New Year's resolution? Yeah, how long did that last? So learning how to make yourself part of your own schedule is a really huge thing, especially if you're a provider, because we're so busy taking care of other people that the last person we take care of is ourselves, because we've got our patients, and then our business, and then our family, and then our house, and then everything else, and then maybe we make it on the list maybe once a year, I don't know. So this SNOWBALL is an acronym that goes over several self-care strategies that most people don't really think of as self-care strategies. Most of them are free. S is for sleep, making sure that you are getting enough sleep during your pregnancy and before your pregnancy, and certainly after your pregnancy ends, when you have a new baby, getting to that 4 to 6 hour mark of sleep every single day. Protecting your sleep is hugely important for preventing psychosis, and also just preventing that depression, that anxiety, because neurologically speaking, you just can't get what you need or function without a 4 to 6 hour stretch of sleep every day. So if that's not happening, we say, how can we help you make that happen? Does it look like bringing in extra family members to get you the support during the night that you need? Does it look like a postpartum doula who comes over and gives you some support? What can we do to help you achieve that? N is for nutrition, so looking at reducing the amount of processed foods and sugars, alcohol, caffeine, things that we know contribute to dehydration and anxiety and depression. And looking at ways to supplement. So O is for omega-3s. So for most of us, we'd rather take something that is a natural supplement before we go to a medication. So trying 3,000 milligrams daily of fish oil, a good source of fish oil, can really be helpful. And the evidence, the literature and studies says that it can be as effective as an antidepressant for reducing anxiety and depression in pregnancy as well as in postpartum. Vitamin D is another supplement. I always recommend getting your vitamin D levels. Most OBs and midwives are checking vitamin D levels throughout pregnancy and postpartum anyway, but 10,000 IUs of vitamin D is what the literature and training at Postpartum Support International recommends for also being very highly effective, as well as bright light therapy. And we live in a very sunny state, so early morning bright light can be very effective. Some people find that it's too stimulating in the early morning, and if it is, then I recommend trying it at midday. And so looking at ways that you can get that natural vitamin D that soaks into your skin and gives you that natural source of mood support as well as health. W is for walking, so a daily gentle exercise, even stretching, something that's 5-10 minutes a day that just gets you outside and connected to nature. That is something that most parents will say really helps. B is for breaks. So we all say we need a break from a baby, but how many of us ever actually do that? Most people tell me I feel very guilty doing that because my husband works so hard, and then when he comes home, I don't want to hand the baby off because then he's going to be tired, and then I feel guilty, and then the baby will cry and he'll say, I can't soothe him, and he'll hand it back to me anyway. Yes, we all live that life. So finding ways to give yourself permission to have a break, and also find your partner a break. You both need a break. It's not just about women, it's also about men. So making sure that you both have a good, I say an hour a day, like time to yourself, just to be in your own body. Yourself would be ideal, but I recognize it's not possible for everybody, so I just say do what you can. If it's a 10-minute shower instead of a 5-minute shower, then take that. If it is a walk around the block that takes 5 minutes instead of a 30-minute longer walk, then do that. Do what you can, start there, but that little bit of gentle exercise is also highly effective at modulating mood. And adult time. Adult time is critical. How many of you have had a problem where you feel like you and your partner are just ships that pass the night, just roommates? When baby comes, or even during pregnancy, it's just life is very busy. So finding that scheduled adult time, getting that time at least once a week, if not every day, just checking in with one another for as much time as you can, and making it a priority instead of letting it slip off the list entirely. I work with couples all of the time, I work with moms all the time, and my husband and I work on this all the time. Just how much time are we actually saying is important for our marriage, for ourselves as a couple, or for our family to spend together when there are things that are competing, like dishes and laundry and responsibilities to family members outside the house and all of our work that comes home with us. So just recognizing and setting some boundaries, that B word that we all love so much. For that. And liquids, 64 ounces of water with electrolytes, I'm told by IBCLCs, is highly effective for preventing dehydration and making sure that that too is a trigger for anxiety, depression, and laughter. So Shannon brought up, don't watch thriller movies if you're super triggered by them, even though they were your favorite thing and that used to be a really fun thing for you to do before now, but all of a sudden you find yourself like not enjoying it and you're like, no, these are my favorite things, I'm gonna keep doing it. Law and Order SVU, yes! Before you go to bed, and then you have these nightmares, right? So I always say, watch a funny show, watch something that makes you laugh, belly laugh, something that you and your partner enjoy together, that you can text each other funny gifts of throughout the day. Just, something that really brings that joy back to life, and music. Music that makes you dance around, feel good, makes you feel like yourself again. Those are all very highly preventative. So when it comes to prevention, I always say just think snowball and use these tips, keep them on your refrigerator. That goes a really long way. So, next.
The other things that are out there is social support. And now in the Valley, there are support groups that are free at various hospitals and many locations. And if you're not sure where they might be, Postpartum Support Arizona chapter has a warm line that's free. It's manned by trained volunteers, moms that have been there, that have experienced this, and there's a resource list of all the resources available around the Valley. So social support is a big one. And it's finding your people. That's one of my things, is who are your people? And when my kids were little babies, I went to a Gymboree class, and I was full of anxiety, and everyone seemed so happy, and I thought, these are not my people. So we had to find your people. Like, everyone was happy, but what is wrong with me? I'm not happy here. So finding your people, and sometimes that means a postpartum support group or a pregnancy support group.
Therapy is very effective. We know that cognitive behavioral therapy and interpersonal therapy are best practices for treating a perinatal mood and anxiety disorder. Therapy is scary though, I know that. I mean, I'm a therapist, and when someone told me I needed to go therapy during pregnancy and postpartum, I'm not doing that. Are you kidding me? Right? What the heck? But therapy it can be very scary. But the reality of it is that there are plenty of therapists in the area now that specialize in this, and most of us are survivors ourselves. So we come at it from a totally different perspective. And I would just encourage you, I know it's a scary step to take, take it. You deserve to get the help and support that you need to be the best you can be, because we know that with proper care you move really well. And then there's complementary alternatives, as Cara mentioned, and then there's the medication support. And I don't know if you want to talk about that.
Sure. A lot of times in my office, we talk to patients about using things like lavender. There's actually oral lavender that you can take, which is very anti-anxiety. There are some herbal things that are safe in pregnancy, and maybe you just need adrenal support. I mean, we have acupuncture. Acupuncture can be very helpful. Massage, yoga. I mean, it doesn't have to be like, huge exercise. It can be like a gentle, relaxing, restorative yoga. There are so many options out there, and I think it's just getting a plan together, just a plan. Little baby steps, 2 baby steps. Can you sleep 2 nights a week? Can you have somebody else take the baby and sleep 2 nights a week, and then go out to have coffee with one of your friends? Take the baby with you. You know what I mean? Like, they're going to want to hold the baby anyway, because, they want to hold the baby. We all want to hold your baby, just so you know. We're all like, let's just steal a baby from some people. Our babies are big. We just want to steal them. So I said, some of these women will probably be like, sure, take the baby for 20 minutes. You'll give me 20 minutes to just sit here. Baby steps, ladies, baby steps.
I just wanted to add a few things to that. I think also the treatment depends on what your diagnosis on the spectrum is. I think we've thrown the term around spectrum a few times, and I really wanted to, it's a little off topic, but I think it's important. We've heard depression, we've heard anxiety, but did you know that there's something called postpartum OCD, and there's also people who get triggered bipolar postpartum, and there's also PTSD. If you had a traumatic birth, or if you had anything, and trauma, people, we think like you have to be in combat, you have to be in battle. Trauma is in the eye of the beholder. So if you had something in the delivery room that you thought was just scary, and that is replaying in your mind, then there are different modalities of treatment for all of these things. So I just wanted to bring that up because a lot of people don't realize the OCD component and the PTSD component, or rage sometimes. I had severe postpartum insomnia, which was tied into a lot of other things. And then the second point is, we've heard all these great modalities. I think a great point is just to be kind to yourself, no matter where you are, and be accepting of whatever it takes to make it work for you. And I'm going to portray a flip side to all these great things. I tried the exercise, I tried all this stuff. It was not working for me because I was really in a bad place. So I've been on the SSRIs, the cocktail that I was on antipsychotics, I was on mood stabilizers, I was on sleeping stuff, sedatives, I was on hypnotics. I was on the spectrum of meds, and it took that much to get me back, and I'm not ashamed. And so I want to put that out there, not that you guys will need all of that, but if you need the entire pharmacy like I did to get back, that's okay. I will say that loudly and proudly because my son has a healthy mom here today because of that. So whatever it takes to make you better, that's okay. So I just want to have that.
Healthy mom, a healthy baby. And just really quickly, it's really important to have
this discussion with a person who is qualified to talk about perinatal mood and anxiety disorders, not a primary care doctor maybe who is not as experienced, or a pharmacist who you go to try and fill a prescription while you are a pregnant mom and they go, I'm not gonna fill that for you, you're pregnant, are you crazy? Yeah, you don't know anything, okay? So bye-bye, call my doctor, okay?
No offense to any pharmacist.
But anybody who would say that to a pregnant woman, I would like to reach out and, just kind of grab them and say, what are you doing? Because again, the stigma, like you just reinforced a ridiculous stigma. There are many medications that are safe and effective. And as Cindy mentioned, if that's what it takes to get you back, then that's what we're gonna do. And we're gonna do it based on evidence from trials that have told us exactly what can be helpful, and we're gonna tailor that treatment to you. So just a plug out there for not just any doctor prescribing, but the right doctor prescribing and the one who partners with you and makes it your.
And on that note too, like I've also had to have patients be taken to the emergency room and be admitted for help, for behavioral health, because we're truly scared for their well-being. And that's okay too, because these mamas are, they have healthy teenagers now, and they're there for them. That's what we're here for. We're here for you, to help you. I don't know if anybody read The Red Tent, but it's an excellent book. And it's about when we used to have many women all go into the tent, either monthly or when the baby was born. We'd support them, we'd nurse each other's babies. We don't do that anymore as a society, We don't even take siestas anymore. We should. We go to Starbucks and they make a lot of money from us, a lot of money. I do it myself too. I really take a siesta, but I go to Starbucks because I gotta push through. But we have to take that time out for ourselves. We gotta give ourselves a break sometime. If the dishes are this high and the laundry is this high and the baby goes to sleep and I can go to sleep, I should go to sleep. And forget about the laundry, forget about the dishes, right?
Okay, sorry, I don't mean to cut you off, but I think we're totally out of time a long time ago. So, I really want to thank everyone, and I'm sorry. But I want to thank all of you for coming here, and I want you to share your stories with us and each other. There's nothing more powerful that we keep the conversation going. There's a lot of ways to get involved legislatively. If you want to talk to Cindy, other people, we're trying to do a lot in the state of Arizona, March of Dimes, and 2020 Mom, the Blue Dot Project, a lot of different ways to get involved if you want to help move things forward in our state, which, we do need to move forward in this state. But we also have so many providers here today who deal with this stuff. What I mean is counselors and therapists who actually take insurance now and can really be there for you. And if you know someone who needs some help, pick up some forms today, put them in your phone so that you have those phone numbers at the ready, because we all know pregnant women, we all know dads can get this too. I'm really glad the men are here, because you experience things maybe differently, but still very intensely. And it's hard also to see your partner go through this, and we didn't even get into the relationship issues. But I just want to thank you all for being here, and please, we're all available afterwards, and we all want to make this better for our state. So,
Can I say that thank you to all the moms I see here who are pregnant with newborns, because I don't think I was on my